Good morning. My name is Bob Oliai. I'm one of the cytopathologists at ProPath Laboratory. This morning I'm going to talk about how to triage an endoscopic ultrasound fine needle aspiration biopsy specimen. Hopefully it'll clear up some confusion. So in front of me I have the various containers and solutions for the various types of testing and specimens that you're going to be submitting to ProPath. And let's start with the direct smears. So I'll move these aside. We'll concentrate on this. And what we have here is a slide carrier for your slides, spray fixative, and the actual slides. And I'm going to make this very simple because we're not going to be using this. Basically, these direct smears are problematic because various types of people try to make these slides. Sometimes they don't turn out very well. They're only useful to know if you're in the lesion. And from our point of view, there's really not a whole lot we can do with them. We can't do any kind of ancillary studies with them. We can't do any molecular studies. We can't do anything like FISH. So, I believe there's really no point in collecting this kind of material in the direct smears because, especially in your context, because you're dealing with a limited material to begin with. So let's maximize and get the most bang for our buck by concentrating on submitting our specimen in a way that'll be the best for us being able to give you the most specific diagnosis. So let's forget about this. We're not going to deal with direct smears. Moving on, that makes it even more simple because what we have here is a container of formalin and a container of cytolite. So what I would recommend is when you get the specimen, I would submit the specimen, maybe a pass, one solid pass into this cytolite material. This will allow us to make thin prep slides, which is very useful because they'll give us nice cytology. We'll be able to see nuclear detail very well. And so I would recommend putting some of the material, and I would say no more than 1 or 2 needle passes in this solution. This is formalin. We use this to make a cell block. And this is the key. We want to make sure we have good cell block material because the cell block material essentially becomes like a small biopsy. So with this material that's formalin fixed, I can do routine histology with an H&E, which is very useful. And then on top of that, I can do immunostains to phenotype a tumor if that's what we find. I can also do immunostains that are useful for ancillary studies, for example, maybe for treatment, finding out if a certain drug will work on a tumor. And in addition to that, I can use this to do molecular studies and FISH studies. So this is golden right here. And if you have to err in submitting everything in here. And so I would recommend 3 solid passes if you can. I mean, of course, if you don't have that much material, you can't do that. But if you can, I would put as much as you can in here because this is going to give you a lot of diagnostic horsepower. Now, worst case scenario, it's not a big deal because if you just have this, the cytolite thin prep specimen, we can also use this to make a cell block. So either one of these really and you're golden. But if you have both, I would recommend you do a pass, maybe 2 in your cytolite material so you get a nice thin prep slide. And the rest of it, 3 or more passes, go here to make yourself a good cell block. And you should be covered. And you should be able to do we should be able to do pretty much anything that we need to do to make a diagnosis. That is, if there's enough cellularity. Now, I'm going to also talk about this solution, which will come like this. It's a pink solution, and it's called RPMI. That stands for Roswell Park Memorial Institute solution, where it was invented. And we're only going to talk about this in one context. The context is if you're worried or if you know that this patient has a lymphoma. This is solely used to be able to do flow cytometry. Now, you can use material in here for some other things, and we have done that. But this is a material that you're going to submit a pass or 2 passes at least fully if you want to do flow cytometry. For example, if you think the patient might have a lymphoma or maybe a leukemia. And so we include this probably not something you're going to run into a whole lot in FNAing the pancreas, but we have seen lymphomas in pancreases. We have seen patients who've had histories of lymphomas who have pancreatic masses. So you may want to do that. The key here is two things. One, enough cells. You need 1 million cells to be able to do flow cytometry. So you're going to need to do 1 or 2 passes just for here to get yourself a good flow sample. And the second part of it is you need to get this to our lab quickly, because this is basically nutrition. It's nutrition for cells. It keeps them alive, but it doesn't keep them alive for very long. It keeps them alive for maybe a day or day and a half. So you need to get this to our lab so we can run the flow, and you need to order the flow if that's something you want. So this is not something you're going to use a whole lot, but it will be useful in cases where you have somebody with a history of lymphoma, history of leukemia, or you're worried that the patient may have lymphoma. So that's all I'm going to say about the RPMI. We should provide it to you if you'd like, if you need it, or you have a patient that you're concerned about. Now, cystic lesions. Cystic lesions of the pancreas are a little bit different, but you're not going to submit the specimen really any differently, other than what's going to be important is most of the time you're going to end up dealing with a hypocellular specimen. A lot of times you're going to get, if it's a cystic lesion and it's not very cellular, you may end up getting a diagnosis that is non-diagnostic because we don't see a whole lot of cells in it, because what you did is you kind of aspirated the fluid. In that case, I think what's going to be more useful for you guys on your end is basically submitting the chemistry of that cyst fluid. So that is something that we don't do here in-house. I believe that that's something that you all send from your center to whatever clinical laboratory you're using to do cyst fluid analysis. So I would just recommend you make sure and get that done. Again, that's not something that we're going to talk about exactly how to submit it, but I believe you'll get a sterile tube from your clinical lab, and that will be what you use to submit that cyst fluid. And that'll be helpful. Not to say that you don't want to submit some things here too. You also want to submit some material, maybe a pass in this thin prep material. You also may want to submit some material for a cell block, but a lot of the times you're going to be dealing with very hypocellular specimens, and they may not be diagnostic. So that chemistry is going to be very important in those cases. That's not to say that we haven't diagnosed cancers and cysts or cystic cancers. They can definitely happen. So I would not blow off these specimens. I would definitely submit some material for us as well. And that's pretty much everything there is to say about submitting endoscopic ultrasound FNA specimens. If you all need to give me a call, I'm at ProPath. If there's anything that you're confused about in this video, don't hesitate to call me. But I just try to keep it simple and maximize your diagnostic bang for your buck. So that should be pretty much it. Thank you. Thanks for your time.